Thank you, Marga, and good morning, good afternoon, good evening, everyone. It's a pleasure to be with all of you today. I am very grateful to the Women in Data Science founders and the advisory board for the opportunity to be part of this terrific event. As Marga mentioned, I am privileged to lead data and analytics for Evernorth, Cigna's health services segment. And my education background is in applied math and statistics. I started my studies in Ukraine, and I later continued grad school at the University of Maryland, where I did my all but dissertation work in this field of statistics. I was fortunate to grow up in a family of engineers and scientists, and so this career path seemed, pretty easy and natural. But I'm most proud of to share that my daughter Anna has continued in this field as well. So we have the tradition of women studying mathematics and sciences and working in STEM. Anna finished her PhD 3 years ago at MIT. She studied operations research, and she now works in asset management. So like many of you in this field, I and my family are very passionate about what we all do. And having done this for about 25 years, starting in research first and then continuing into various roles in financial services, consulting, property casualty insurance, and now in healthcare and health services, I feel very fortunate to be able to apply this skill set to create value for people in these various fields. When I think of what we do at Cigna and at Evernorth, I just want to introduce you a little bit to our company. I have had an amazing opportunity to join Cigna Corporation 2.5 years ago. We are a Fortune 15 global health services company. We have over 175 million customers around the globe, and there are over 72,000 employees across Cigna Corporation. We are truly mission-driven. Our focus is on making healthcare better, making it more affordable, making it more predictable, making it more transparent. And as probably all of you know, as you experience this yourselves, healthcare is complex, and it's complex across different countries, not only in the U.S. We provide a wide range of services, medical services, pharmacy services, a variety of health services, both within the U.S. and outside. We're serving commercial employers. We provide Medicare, Medicaid, affordable care plans, and a number of other specialty plans, dental, vision, pharmacy, and other types of benefit management. And Evernorth is our health services segment that's driving innovation and is truly focused on creating a dedicated platform that distributes better health solutions to our different partners and the clients. We are in the middle of the exciting journey as part of the data analytics team at Evernorth and at Cigna. Our focus is really building out a leading capability, and we work in one of the most data-rich industries that I've ever experienced, and we believe we can contribute in meaningful ways. And I'll talk a bit today about how we help our customers navigate their health journeys. We'll speak specifically about the complexities that the current pandemic environment creates and how better information and better intelligence actually helps us solve for that. So 2 things I would like to cover today. One, we'd like to illustrate how we leverage data and analytics to address our current challenges. We have been very much engaged in supporting our customers through the COVID-19 pandemic, and both addressing their current needs and anticipating the emerging post-pandemic health issues. Secondly, we'll talk a little bit beyond COVID, how we're leveraging data and analytics to solve for end-to-end disease management, which is one of our major focus areas. First, let me touch on COVID. This is probably something that everyone is very familiar with. It's, across our news feeds every day. COVID has had a very significant impact on our society. It has had significant impact on healthcare across the globe and the systems that are under pressure, dealing with a significant level of infections, significant levels of hospitalizations, and also, very high fallout in terms of death rates in the U.S. alone. We recently passed a fairly grim milestone of 500,000 total deaths. And this is a tremendous challenge. And the pandemic has spurred the unprecedented innovation in pharmaceuticals, record-breaking pace of vaccine development, which we've all observed. And since the vaccine distribution began in the US on December 14th, more than 85 million doses have been administered. We have reached nearly 17% of the US population who have been vaccinated at least once, according to the CDC. And we're currently administering over 2 million shots per day in the US. But there's still a very long road ahead for us to feel that we've gotten sufficient percentage of our population vaccinated. At Evernorth and at Cigna, we are responding continuously to a number of challenges that this pandemic has presented us with, and we ensure that we meet our customer needs. On the medical side, we've waived various out-of-pocket expenses, co-payments, doctor visits, treatments. We've offered pre-prescription shipping, and much, much more. And from the data and analytics side, our team has recognized very early on that this has had a tremendous need for analytics, both understanding what's happening, but also, and more importantly, creating predictive intelligence and anticipating and addressing COVID risks. In doing all of this, we've encountered quite a few technical challenges, and I think it's worthwhile giving you a little bit of a flavor of how our data, first and foremost, presents those challenges. If you think of data in healthcare, we have a very rich ecosystem of sources of data and how this data comes together. It's also some of the most complex data because we receive data oftentimes through internal and external sources. The data comes at different time points and oftentimes is lagged. We depend on a number of parties: customers, employers, healthcare providers, data aggregators, government agencies, health information exchanges. They're all feeding data to us and in some cases to each other. And data is not always digitized in healthcare, believe it or not. We still see a lot of paper files. We see a lot of data that comes through fax and other media. So there is a tremendous need to actually pull this data together in a usable form, making sense of the vast amount of information where it's not always coming in ready for types of analysis that we do, and also ensuring that the data actually is consistent and accurate. We've seen many cases with data, particularly COVID data, and everyone's experienced this in the past 12 months, where infection data is reported by providers and by local governments, and oftentimes the way that it's being reported is not entirely consistent. There are gaps in data. There are important diagnosis data points that take up to 3 months oftentimes to come in post the actual event occurring. There are new diagnostic codes that have been created specifically for COVID. They've been created in a very rapid fashion. However, it takes time to actually start receiving data in that format, and they're continuously updated. And coding is done by humans, which means data definitions are often inconsistent. And we have to solve for that in various ways by cleaning and processing this data and transforming it. Good data, ultimately becomes a foundation of our analysis and ensures that we create reliable models and reliable decision support. And so as we think through this, the very first step that we've taken, trying to get these slides to advance, here we go. The very first step that we've taken is to focus on predicting infections and hospitalizations. There are a number of industry models that do that. We've created our own because we wanted to be very specific and have intelligence that applies to our customer base much more accurately. Our team of statisticians and epidemiologists has been working on this for nearly a year now. We're using the SIR epidemiological modeling approach to develop forecasts. They're specific to our customer base and the geographic distribution of our customers across the U.S. We also look at demographics and health profiles to account for various factors that drive infections and drive hospitalizations. These projections are leveraged on an ongoing basis. We have also forward-looking scenarios that are modeling different ways we think the rest of the pandemic may unfold, depending on a number of assumptions and factors. And we are making decisions very specifically based on these forecasts regarding our customer outreach, regarding how our COVID-19 call centers are staffed, and focusing on how we provide medical management services to our customers. We engage customers with severe and moderate COVID cases very specifically to make sure that they receive additional support, and particularly if they're hospitalized post-hospitalization, that they're seeing their doctor and that they're receiving the additional care that's needed to avoid rehospitalizations, avoid emergency room visits. And we've seen a tremendous impact when they are engaging with us and going through our case management programs, and also working with their physicians and keeping their follow-up visits. Our analytics show that we're tremendously decreasing the number of complications and hospitalizations that may occur in the post-COVID state, and that's important from a health outcome perspective. Beyond this initial modeling, we've actually expanded to create a full suite of COVID analytics that drives very pragmatic, actionable recommendations through a number of sophisticated predictive tools. We work very closely with employers to help them understand how their employees may be impacted, where their risks are, and how they can better manage these risks within their employee bases. We provide self-service tools that break down the information at the national, state, county level, and we're guiding employer decisions to help them bring employees back to work safely. This toolset includes also a number of predictive models that assess individual health risks. So we're leveraging the information to do proactive outreach, and I'll give you a few examples in the next few minutes, and make sure that we are assisting customers, as I've mentioned, if they are experiencing a severe case or a moderate case of COVID that requires follow-up post-hospitalization. And we're also tracking patients longitudinally. We've created a registry that identifies potential risks of deferring essential care, and we're also tracking long-term complications arising from COVID. Here is one illustration, give you a flavor of the richness of information and predictive capability that we have. We're looking at high-risk populations and trends much, much deeper, leveraging a variety of analytics and machine learning tools. I've mentioned the registry of patients that we've created and the long haul symptoms for these patients, as well as emerging diagnoses. One of the interesting findings that came out of this work is that 1/3 of our medical customers with COVID have pre-existing chronic conditions, and this is much more likely to worsen if they show signs of persistent symptoms. And beyond this, we understand that we need to predict who is at risk of post-COVID complications and how we control that. Jumping ahead, just a couple points on what we do beyond COVID. We are working across a number of different diseases and chronic conditions to be able to help predict these outcomes. And we know that we cannot change the diagnosis, but we can change the outcomes. One of the key examples of what we do in this space is the oncology care management. And our predictive analytics for different oncological conditions. This example here is predicting breast cancer. And we know this is a very severe disease. Our team has created models that helps identify customers with likely breast cancer diagnosis sooner, so we can help them get the right treatment, make the right decisions with their physicians, and get back to health sooner. We have lots of other examples. I know our time is wrapping up, so I want to thank you all for the opportunity to share this with you today. I also want to just wrap up by saying that it's been an amazing journey for me, and I've been fortunate to work with a smart, diverse team of healthcare and data analytics professionals. And I wish all of you to find this kind of passion and meaning in everything that you do, and find a way to combine the interesting work with the purpose. And I'd like to thank you all for letting me share this journey and findings with you today.